Hi, welcome to Clyde Health's Medically Speaking. Each month, we'll explore a variety of topics to help you better understand certain medical conditions and treatment options. My guest today is Dr. Sridhar R, the Medical Director of the Advanced Orthopedic and Spine Center at the Buffalo General Medical Center. We'll be discussing total knee replacement, the industry shift in treatment and recovery. I'm Mike Hughes, and this is Medically Speaking. Welcome, Dr. R. Thanks for joining us. Can we start by talking about knee replacements and how frequent that is happening? How many people across the country are going through that these days?
Last year, about 700,000 patients had knee replacements. The need for knee replacements is only going to go up. It's estimated that the need for knee replacements is going to go up 5 times to about 3.5 million in next 12 years.
So is the average age coming down if more and more people are having it done? So is the average age coming down? And what are the main reasons for people having to have their knees done?
The average age is coming down because of various reasons. Number one, the factors that predispose to knee replacement are becoming more and more. The obesity is becoming more. Patients are living a very active lifestyle. They're prone to injuries and all that stuff that predisposes to knee replacement and arthritis. And also our technology and techniques have improved. So in general, we feel more comfortable doing surgery on somebody who needs surgery at a younger age than previously. So previously, this patient, when they were suffering with pain at a younger age, we used to say, just live with it until you're 50 and then come back to us when you're 50.
Right.
And with the techniques and the technology improving, we feel more comfortable than what we used to offer surgery to these patients so that we can alleviate their pain.
So you talked about how you said things have changed. You used to say wait till you're 50. What else has changed in terms of maybe surgery techniques or even rehabilitation?
The implant prosthesis part has had some modifications. More than the prosthesis, our understanding of the knee, per se, knee is a very complex joint compared to a hip, which is other surgery I do. Knee is a lot more complex joint than a hip joint. So replacing a knee is a little more challenging because there are various factors that are involved. First of all, our patient selection has become better. So we're not offering surgery to patients who don't need it. That's the most important part of the equation. And then once we have that part squared off, we are educating the patients better in terms of what to expect, what not to expect. And thirdly, our surgical technique has improved over the last few years, and our understanding of the knee as far as what's right, what's wrong. Our fixation techniques have improved. The amount of surgery we do is also kind of decreased. Previously, the incisions used to be bigger. Right now, we figured out that It doesn't need to be that extensive.
Sure.
And the new technology in the form of robotic assistance or computer assistance has come in to make the surgery more precise and personalized to the patient.
Sure. So on that, talk a little bit more about the robotics and the less invasive side of surgery. So what does that mean for the patient? Is that less bleeding? Is that less pain? Is it quicker recovery?
It means quicker recovery, more predictable patient outcomes, and shorter hospital stay and shorter rehab time. So patients who used to take a longer period for recovery are able to recover faster. Part of that is also the mindset. We understand our understanding of the knees, the way they work, in terms of our ability to rehab them quicker has become better.
Right. So the orthopedic industry is learning more about those types of procedures and the best way to treat patients. We talked a little bit about rehabilitation. What has changed over the last 5 to 10 years for patients who have to go to rehab? Does everybody have to go to rehab? If so, is there a standard protocol? You're there for 3 days, 5 days?
A lot of patients who need knee replacement are able to go home. It's rare that some patient needs a rehab, usually for social reasons where somebody lives alone. There's some reasons sometimes when we need to send the patient to rehab, an 84-year-old grandma who has a knee replacement who lives alone. We're not going to let her go home and live alone and struggle through this alone. So she's probably better off in a more controlled setting like rehab. But for most part, after a day or two hospital stay, in some cases, patients go home the same day. They're able to do well at home with the nurse and therapist visiting them at home, and they do just fine. So not only is this better for the patient, it also cuts the healthcare cost down.
Right. You mentioned robotics before. Where do you see that part of the orthopedic industry going? Is it something 10 years from now we'll see that's more standardized, or it's still a physician preference, patient type that comes in that will determine if that's the proper surgical technique?
Any industry that requires precision doesn't depend on human error. Anywhere you go, aviation industry, I mean, for most part, computers and robots,
Sure.
we depend on their precision with a human overlook over top of that. We're not going to depend on them 100%, but, we do want that kind of precision. So I do see these robotic surgery evolving more and more. We are just on the first and second generation robots at this point. This is going to become a lot more versatile, a lot more useful. Would it replace a surgeon? I don't think it will, because you still need a mind to make a decision and
Sure.
act accordingly. But as far as the surgical procedure goes, there's no question that it's way more precise than what a human being can do.
Right.
If I can give you an example, it's like, you hitting a target, yourself shooting.
Sure.
You have a certain amount of error, right? If you use something like robot, it hits a bullseye every single time.
Right.
Now think about that target moving,
Right.
and you hit it yourself. Your error is going to be a lot more. The robot is able to hit a moving target very precisely any given time.
Yeah, I just think there might be a stigma. I guess it's probably getting better, but there might be a stigma with, well, geez, I'd rather the physician operating, not a robot. And I think patients and the general public need to overcome that stigma and understand what the robot actually does and how it actually helps a surgeon. So if you can, explain a little bit more about the precision and the accuracy.
That's a great question. It's not like robots doing the surgery and we're going and having coffee. That's not what this is.
Right.
This is a robot assisted. So the surgeon is still doing the surgery. He's still holding the robot. Unless he provides mechanical force, it won't do anything.
Right.
So it's not like, Judgment Day is happening.
Right.
That's not what this is about. This is about having a better tool to perform the procedure in a more precise way. It won't work without the surgeon moving it. He has to still press the button to move it. And as soon as his finger is off it, it'll stop.
Right. So robotics is just one way that the orthopedics industry has changed. Shorter hospital stays, better patient outcomes. What else is happening industry-wide that you see that is changing, or what else has maybe changed in the last 5 to 10 years?
Our understanding of pain control after the surgery, the philosophy has changed. And to a large part, to be honest, the improved outcomes and the shorter stay has to do with our understanding of the pain control. How do we control the patient's pain immediately after surgery? Now, pain is a subjective phenomenon. Everyone responds to pain differently. There are some who look at you and say, it didn't hurt me.
Right.
There are some who have a significant emotional response to it. So now how do we manage the pain across the board? We figured out that if we can control the immediate post-operative pain without the patient having significant emotional response to it, where they're sensitized to the pain, their recovery seems to be quicker. So we have various modalities where the patient's now waking up from operating room in severe pain. We do blocks, we do injections, we give continuous post-operative anesthesia, local. That I think to a large part that's also helping us out. Again, accelerated recovery where we are sending patients home, making them move around, making them believe that they can do it. And for most part, a positive mindset goes a long way.
So you're part of the Buffalo General Medical Center and the Advanced Orthopedic and Spine Center. Talk about the team there and the type of work that you guys do. Why is it so important to have that team approach towards orthopedic surgery, whether it's hips, knees, shoulders? Tell us more about the Orthopedic Center there.
So we have a group of surgeons. Again, obviously, it's not just the surgeons that make the difference. It's a staff. We are a team, not just a team of surgeons, but the team of staff. I tell my patients that it's not just me. There are about 20 other healthcare personnel that are part of the team that play a vital role. I do the surgical procedure. I see the patient. They work under my guidance, but they're doing an excellent job. It starts from the nurse that checks the patient in. even before that, they go to pre-admission testing and they have an education class. The patients spend about an hour knowing what knee replacement is, where do they come, what do they need to be prepared for, what clothes do they need to bring. These are not the stuff that I address in my office visit of 15 minutes.
Right.
So and all this education is vital. Setting their expectations right, setting their goals right, and the therapist working with the patient post-operatively, the nursing staff identifying the problem and involving the doctor at an appropriate time. These are all vital parts of the recovery.
Sure.
So having that team approach and having a center of excellence like what we have at Buffalo General, where we are focused on hip and knee replacement. We do close to 2,000 hips and knee replacements over there. Right. So we have developed a protocol and a team-based approach that works very well. That cuts down the problems.
That's great. So last question, someone is suffering pain, they know they have arthritis. What advice do you have for someone who may be having some difficulties with their knees?
Just because you have a pain in the knee for past 10 days doesn't mean you need to get knee replacement. That's the best advice I can give.
Sure.
If you can live with the pain, live with it. There are various ways to control the pain. Tylenol, Motrin, losing some weight will help, whatever way. It's kind of difficult when you're in pain to exercise, but there are other ways to lose weight, figuring out intake, output calories to lose some weight, even that will help. Not doing things that hurt you the most will help. But at any given point, I tell patients to think about two things. Think about the amount of pain they've had over the past 6 months. And think and see if it's bad enough for them to need anything. If you have some pain and you can live with it as long as you can. If it's at a point where it's not acceptable, that's when we go to the next step.
Sure.
So this is not like, these problems are not like cardiac problems or oncology problems, cancer, where if you wait on it, something bad will happen.
It's not
like
life-threatening issues. Yeah. Dr. Rishala, thanks for joining us today. So much is happening down at the medical campus, the Buffalo General Medical Center, as well as the Advanced Orthopedic Institute. So thanks for joining us today.
Thanks for having me.
Thank you. Thanks again for joining us today. I'm your host, Mike Hughes. We'll see you next time on Medically Speaking.